Welcome to RealLab, the first laboratory that believes in the importance of the ongoing plan of care and survivorship care for the patient that comes following the results from our tests. A new study in the Journal of Oncology Practice, JOP, finds that while primary care physicians, PCPs, are often involved in cancer survivorship care, many do not feel adequately prepared for key components of it. Until now. With an estimated 17 million cancer survivors currently in the United States, a number projected to increase by 29.1% to 21.7 million by 2029, the need to optimize the care between oncology and primary care is imperative. The new study titled Practice, Preferences, and Practical Tips from Primary Care Physicians to Improve Care of Cancer Survivors shares the results of a survey of 117 PCPs in practices affiliated with a large academic medical center to evaluate 4 key areas. 1. Current practices in care of cancer survivors. 2. Sense of preparedness to deliver such care. 3. Barriers to care of cancer survivors. 4. Preparedness for shared care and communication between PCPs and oncologists. A majority, 82% of respondents had been practicing for more than 10 years and saw a median of 36 patients per week. Nearly all survey respondents reported that they commonly assume primary responsibility for at least some aspects of survivorship care. Key results of the survey include practice of and perceived preparedness for care of survivors. 94% reported that they may assume primary responsibility for managing and/or making referrals for psychological consequences of cancer or its therapy. However, only 25% reported that they felt very prepared to do so. 84% reported regularly assuming primary responsibility for the management of chronic physical complications of cancer therapy. Yet only 10% felt very prepared to do so. 65% felt unprepared to screen for late complications. 36% felt unprepared to screen for reoccurrence. With RealLab, we can bridge the gap. With the use of our genetic counseling team, along with follow-up representatives, we can break down any barriers to providing care to survivors. Did you know 73% were uncertain about delegation of responsibility? 72% lacked needed training. 56% reported that patient preference to have their oncologist manage cancer-related issues served as a barrier. 34% reported feeling that oncologists prefer to manage cancer-related issues. Attitudes toward and experiences with shared care and communication. 98% reported that they wanted a survivorship care plan with explicit follow-up care recommendations, but only 11% reported regularly having such access. This study delivers an important message to the oncology community. Primary care providers are able and willing to take part in the shared care of cancer survivors. Nearly all PCPs in the study, 95%, felt that medical oncologists and primary care physicians should share responsibility for survivorship care. However, clear communication and consensus are needed for patient-specific complications, screening needs, and long-term risks of therapy. In Health Diagnostics, RealLab is committed to survivors of cancer who require long-term surveillance, risk assessment, and prevention services. Strategize with RealLab in meeting the needs of the growing population of cancer survivors in the U.S. Let's address provider shortages and rising costs together.